Hey everybody, I'm Brittany Lewis, a breaking news reporter here at Forbes. Joining me now is Senator Marsha Blackburn. Senator Blackburn, thanks for coming on.
I'm happy to be with you, and thank you so much for having me back.
Of course, we have a wide-ranging conversation today, so I do want to dive right in. Last time I had you on was back in March when you discussed your bipartisan legislation, the Kids Online Safety Act. Now you're working on more bipartisan bills, this time in the healthcare sphere. What can you tell us about the most recent one, which is the Patients Before Middlemen Act?
This is something Senator Menendez and I are working on, and we hear a constant complaint from our Medicare enrollees and really from so many Tennesseans about the price of pharmaceuticals at the pharmacy counter. And as we have looked at this and researched the issue, what we have found out is these pharmacy benefit managers, the middlemen, if you will, are taking the profits, the discounts that are offered on certain pharmaceuticals, they're taking those for themselves. And that the patient is paying a higher copay or, in some cases, a higher price to have access to medicines that are on the allowed list from their insurance company. And when you have the pharmacy benefit manager and the insurance company taking those discounts or offered by the drug company, then the patient is the one who is left out. So our bill, the Patients Before Middlemen, or PBM Act, would require that the patient be the one to benefit from these reductions in cost, and that money not go to the middleman, the pharmacy benefit manager.
So does this cut out the middleman or just redirects the profit?
What this would do is circumvent that profit from going to the pharmacy benefit manager. And one of the things that we have figured out is that there is very little value added for the consumer that comes from these pharmacy benefit managers. Now, in the beginning, when they were put into place, maybe they played a part in negotiating with these drug companies to lower the cost. But what has happened is, as they have absorbed the majority of the discount that is offered and shared some with the insurance company, the patient has found that they were out. And Brittany, another problem with this is that these pharmacy benefit managers may take different pharmaceuticals off the allowed list. When that happens, who is it that is going to be in search of something that has been prescribed for them as the preferred pharmaceutical? It's the patient. And I had talked recently with a mom who was facing this. The physician had prescribed a specific pharmaceutical for her child. And then the insurance company changes, middle of the year, changes what is allowed. They took off what this mom had been using for her child. And then she was in a mad scramble trying to continue the medication that her child needed. This is something that could not be interrupted. And she was spending hours and days on the phone with the insurance company trying to get something that would help her continue the care that was necessary for her child.
Something that really is a disgrace is the cost of some prescription drugs. I mean, you've heard stories of people spacing out how often they take their drugs so that they can save some money, and that's just not right. So how much, or by how much, would this lower the cost of prescription drugs?
I think more important than looking at it that way is thinking in terms of access. What people want is access to the drug, the medication that their doctor has said, you need this specific drug or you need this specific therapy, and here is a generic that you also could use in place of one of those. Now, that allows people to have choice and options and to control what they're going to have to spend because they have those options. Now, if that PBM takes those generics off or disallows certain things, then what happens? The patient is going to have less choice, and when there is less choice, they always end up paying a higher price.
And is the generic drug just as good as the other one, the higher priced one that the PBM would be offering?
That's something that is going to be a case-by-case situation, and this is something that patients need the opportunity to discuss with their physician and then thereby make that choice. But what you want is for the patient to be able to control what they are going to choose. Give them choice, give them options, give them the opportunity to control that cost. And when I talk to Tennesseans, that's what they want. They want to be able to work with their physician and decide what is going to be best for them and their family. They don't want a bureaucrat or someone at an insurance company or someone at a PBM saying, we don't care what the doctor tells you. We're not going to let you have that. If you want something, you're going to have this. That's not what they want. Our seniors in Medicare say, we have been paying into Medicare all of our working life, and now we're being told we can't have what the doctor says we need. So the PBM Act is a way to remove this roadblock and allow patients the access and the choice they need.
I do now want to pivot to another priority that you've been working on, which is the rural health agenda. And it's a stat that you cited that really was shocking to me. You from a study from the Center for Healthcare Quality and Payment Reform, and the stats this: more than 600 rural hospitals, nearly 30% of all rural hospitals in the country are at the risk of closing. Before we dive into what's in your package, why is this happening?
This is happening in large part because of reimbursement rates. And Senator Warner and I have worked in a bipartisan manner to address this issue, this specific issue. It has to do with the area wage index. And Brittany, one of the things that is so important to realize is that when you talk about reimbursing hospitals, a piece of equipment is going to cost the same thing in rural Tennessee that it costs in Midtown Manhattan. So the disparity in these reimbursements has made it very difficult for these rural hospitals to keep the doors open. Generally, these are the hospitals that have more Medicare, more Medicaid, and less private pay in their patient mix. So making certain that we address these discrepancies that have come into play and that we move this to parity so that these hospitals are able to keep the doors open. And so individuals that live in rural America have access to affordable health care, and they have access to quality health care right there in their communities. This is the reason we are focused on this issue. And we're so pleased that we've been joined by senators from each side of the aisle in supporting this legislation.
Like you said, all three bills are bipartisan: the Rural Health Innovation Act, the Rural America Health Corps Act, and the Save Rural Hospitals Act. So can you just give us a highlight reel of each of the bills?
Yes, indeed. The Innovation Act will allow for areas where they have lost their hospitals, and Senator Hickenlooper and I are leading this. They can do freestanding emergency rooms, and actually we were so pleased that CMS granted a waiver to Fentress County, Tennessee, and the University of Tennessee Medical Center to open one of these facilities in Fentress County. They had lost their hospital. And we had worked closely with the teams involved in this to make this a reality, and we're able to cut the ribbon on it and have it put into action in late June. And my understanding is that people are showing up there every day. But having these centers where you can use technology, you can use health IT, you can use telehealth, you can use digital imaging, and properly triage an individual and then get them to additional health care if it is needed. Get them to the right place and in a timely manner. Now, Senator Durbin and I have worked for about 3 or 4 years on this Rural Health Care Act. And this would encourage, it would incentivize individuals to move into rural areas for the practice of medicine. It may be nurses, NPs, PAs, physicians, psychologists, psychiatrists, optometrists, ophthalmologists. You might have EMS personnel. You might have dentists. But when they do this and they practice in this area for 5 years, their loans, their student loans, are forgiven tax-free. And this is a tremendous incentive to individuals to start those practices in rural America. And Senator Durbin and I are continuing to work on this issue.
And what has the response been? Obviously, student loan forgiveness has been a lightning rod issue as of late. So are Republicans on board with that?
You're talking about the lightning rod was the way the president tried to use executive authority. He cannot do that. This all has to come through Congress. That is why there is legislation and a orderly process, regular process for addressing these issues. And this would be very targeted. It would be something that focuses just on rural America for access to health care, which is an issue that exists in each of our 50 states.
I do now want to switch gears a little bit, and if you could give us a preview of what is coming tomorrow. And you're sitting on the Senate Judiciary Subcommittee hearing on intellectual property. They're holding a hearing on copyright law and AI. What can you tell us?
Yes, and in Tennessee, AI is an emerging technology that is moving quickly, along with quantum computing, along with innovation in autonomous vehicles and in the automotive space. And tomorrow we're going to look at copyright law and look at these copyright holders and how you keep them whole. Now, in our entertainment industry, you see concerns that are popping up around this, because you do have singers and songwriters and entertainers and publishers and authors who are quite concerned about their content being lifted. AI is trained on it. And then you have apps like Spotify. How do you, if they're going to carry AI generated content, how do you compensate the creator of that content? Likewise, when you have sites like ByteDance, and they are working on an AI generated content application, how are you going to make certain that you are holding harmless the creators of the content that this AI is trained on? And what is going to be the compensation mechanism around that? So we're going to look at the need for online privacy. We're going to look at the need for online policing, intellectual property policing and protections, and then compensation, to be certain that the constitutional guarantee to these creators is recognized and that they are allowed to benefit from their works and creations.
From an outsider looking in, AI really has almost seemed like the Wild West ever since ChatGPT was launched back on November 30th. And since then, it's been really infused in the national discourse. And I do want to discuss with you how you think AI should be regulated. Congressman Darrell Issa said this: Congress has both the opportunity and the obligation to craft policy solutions that safeguard the protection of intellectual property and reaffirm a vital principle that ownership of one's artistic creations is sacred and has inherent value. What do you think these policy solutions look like?
And this is something that we're going to continue to explore. And let's take the healthcare sector, because I'm meeting with the Nashville Healthcare Council just before the AI hearing tomorrow. Now, they use and have been using generative AI for disease analysis, with predictive diagnoses for diseases, with trend lines, with working through pharmaceuticals that could be most effective against certain viruses and certain diseases. And so they have one type application that they are using for this. Likewise, you have other applications that are affecting our entertainment community. So there are foundational elements that need to be addressed first. First is online privacy. An individual needs the right to hold their virtual you, their information, their content away from open source AI. That means passing an online consumer privacy bill where an individual has the right to opt in to share, or they can opt out and say they are not sharing their information online. They set the firewall. You need that one set of rules for the entire ecosystem and one regulator. You need that online privacy bill. You need to put in place protections. That is where you get to the IP policing and protections, so that individuals know that their creations, as I said, this is a constitutional guarantee. And they need to know that they are going to be able to have recourse if somebody infringes on their brand, or if somebody lifts their voice, their likeness, and trains AI and then generates AI content off of what they have said, or what they're singing, or what they're performing, or what they have written.
You've been critical of China in a host of different ways, but especially when it comes to AI. And you've said this: I've watched what happened in China and how they are using AI to grow their surveillance state. Do you think, as Americans, we're going to get into China more in a second, but as Americans, should we fear AI, embrace AI, or be somewhere in between?
We need to be smart about how we approach this. And we need to realize the technology is moving forward, and it is imperative that we put the framework in place. I mentioned online privacy earlier, and look at what has happened when we did not put privacy protections in place. And now people are saying, you have to do something about online privacy, because right now, if they are online, if they are on Facebook, who owns that information? It is Facebook. And right now, if they go into Google and they go from Google to different business relationships they have, that is being tracked. That data is being harvested. That data is being sold. And it is the company that is making the money. It is not the consumer. And that information is being used against their will.
Senator, as I said, I do want to discuss China. There was news that broke last night. You, along with other Senate Republicans, did send a letter to the DOJ regarding China. What can you tell us?
What we're getting at is these police stations that we hear have been set up in some of these soft propaganda operations or culture centers that China has opened. The Chinese Communist Party has opened in 7 different U.S. cities. So what we want to know is, what did the FBI know and when did they know it? And what are they doing about this? And why has this administration not shut these things down? Why did they allow this to happen? And as you know, I have worked tirelessly on making certain that universities realize what is really happening in these Confucius institutes, that many times these individuals that are coming for cultural exchange are actually Chinese Communist Party spies. And they're trying to lift information from some of our universities, research work that is taking place. So we need to pay attention to this, that these centers are being used to surveil Chinese citizens who are in the U.S. They're being used to surveil individuals that may have moved here, that once lived in China and are now U.S. citizens. There are concerns from people. We're hearing a good bit about this. We're going to continue to drill down on this issue and make certain that these get closed.
The DOJ did say back in April that there was an undeclared police station that was operated by Chinese agents, and that was made to, quote, silence and harass dissidents. As we know, earlier this year, a Chinese spy balloon was shot down by the military in the middle of the United States. When Americans hear things like this, what should we think?
They should be aware of what China is trying to do. China wants to be globally dominant by the time we get to the midpoint of the century. They've been very public in this. They think the 21st century should be the China century. When you look at their Belt and Road Initiative, their Silk Road, their great power competition, what they're trying to do is push their way to global dominance, make people dependent on them, control the supply chain so they can turn it off and turn it on when and where they want to. You look at what they're doing in Cuba with the spy base. You look at what they are doing in the South China Sea. You look at the spy balloon that they have floated. You look at what they've done through these culture centers and these sister cities and organizations and relationships, and what they're doing in the Confucius Institutes, and now with these police stations where they are surveilling. And you see that they are intent on surveilling people so they can control people.
I've been able to talk to a few 2024 contenders, and two of them specifically said the United States is in a Cold War with China right now. Do you agree?
What we know is that China is pushing the envelope every single day, whether it is building up their navy and whether it's exercising great power competition, whether it's taking 8% of their GDP and putting it into growing their military, whether it's continuing to push goods into the U.S. Last year, our trade imbalance with China, $1 trillion. We need an administration that is going to be tough with China, that is going to say, you cannot set up police stations in the U.S. You cannot float spy balloons across our country. You cannot surveil our people, and you cannot go after our allies and friends. I'm glad NATO is taking a tougher stance against China. I think that is helpful. I'm glad that you see Japan and South Korea building a relationship and working with other people, other countries there in the Pacific in order to stand up against an aggressive China.
Specifically, after the DOJ answers your questions from these letters, what actions do you want them to take?
We'll see what the DOJ has to say, and then we'll decide what actions we're going to take.
And will the public be privy to what the DOJ says?
Generally, when we hear back from them, or if we don't hear back from them, we make those documents public.
Well, Senator Blackburn, when you do or do not hear back from them, I hope you come back on and join me and say what they said. Senator Marsha Blackburn, thank you for joining me.
Thank you.